Have you ever felt that persistent itch that won't go away? That itchy sensation that drives you crazy? You're not alone. Itching is one of the most common complaints, but do you know when it's just a passing annoyance and when it could be your body's cry for help? This video is an essential guide to understanding it. Itching or pruritus is an uncomfortable sensation that leads us to scratch. It's so common that it's estimated that 90% of people will experience it at some point in their lives. We often ignore it, thinking it's just dryness or a mild allergy. However, this sensation can be much more than simple irritation. More than 20% of general practitioner visits are related to itching, and a staggering 70% of people never seek medical attention. This lack of attention can be dangerous. While 10% to 15% of cases of itching have benign dermatological causes, another 10% to 15% may be the first sign of serious internal illnesses. These can include liver or kidney problems or even serious blood disorders. Ignoring a persistent itch is like ignoring a warning light on your dashboard. It might be something minor, but it could also indicate a serious problem that needs immediate attention. Learning to differentiate is vital for your health. Most of the time, itching has simple, manageable explanations. Identifying these causes will help you alleviate discomfort and know when there's no cause for alarm. Knowing your body and its reactions is the first step toward prevention. Dry skin is one of the most common causes of itching. A lack of moisture in the skin can cause irritation and flaking, which in turn leads to the urge to scratch. This is especially common in cold or dry climates. Using harsh soaps, taking very hot showers, or prolonged sun exposure can also strip the skin of its natural oils. Proper hydration is essential to maintain an intact skin barrier and prevent this condition. Allergic reactions to foods, medications, cosmetics, or fabrics can manifest as itching. Insect bites, such as mosquito or spider bites, are also a very common localized cause of itching. These reactions are usually acute and disappear once the allergen is removed or the sting is treated. Identifying the trigger is essential to prevent future exposure and effectively relieve symptoms. Extreme cold, excessive heat, or low humidity can affect the skin and cause itching. Additionally, certain detergents, fabric softeners, perfumes, or creams may contain irritants that cause skin reactions. Sometimes, simply changing products or adapting to the weather can solve the problem. The story of 32-year-old Maria is a good example. Her itchy legs during the winter disappeared with proper hydration. The problem arises when the itching isn't so harmless. There are potentially serious causes that could be occurring in your body. It's crucial to know when to suspect it and seek reliable medical advice. Certain blood disorders can manifest with intense and widespread itching. Hodgkin's lymphoma, a type of cancer that affects the lymphatic system, can cause itching in 1 in 3 patients. This itching is often unexplained and persistent. Carlos, one of my 45-year-old patients, came to the clinic with generalized itching that had lasted 9 months. He thought it was stress. After several tests, lymphoma was detected. Thanks to this warning sign, the cancer was diagnosed early, which reinforces the importance of not ignoring these symptoms. Liver diseases, such as cirrhosis or cholestasis, slow emptying of bile, are important causes of itching. The accumulation of bile salts in the skin can cause a very characteristic itching sensation. This itching is usually most intense on the palms of the hands and soles of the feet and worsens significantly at night. 70% of patients with cholestasis report itching. It is often accompanied by yellowing of the skin or eyes, jaundice, dark urine, or pale stools. Chronic kidney disease is another serious condition that can cause itching. Between 40% and 50% of people with this condition experience uremic pruritus, the accumulation of toxins in the body, which the kidneys cannot filter, irritates the nerve endings in the skin. People with diabetes and high blood pressure are at higher risk of developing chronic kidney disease. If you have diabetes or high blood pressure and experience persistent itching, it's essential to see your doctor for a kidney evaluation. Diabetes mellitus itself can cause itching due to diabetic neuropathy or increased susceptibility to infections. Fungal infections are more common in diabetics and can cause intense itching. Thyroid problems can also be a cause. Hypothyroidism, for example, is associated with dry, itchy skin. Controlling thyroid hormone levels can significantly improve this symptom. A hormonal imbalance can have multiple effects on the body. Although less common, other systemic conditions can cause itching. Some types of cancer, such as pancreatic or colon cancer, can manifest with itching. Certain neurological diseases, such as multiple sclerosis or stroke, can also disrupt nerve pathways and cause itching. Even some medications can cause itching as a side effect. It's crucial to inform your doctor about all medications you're taking, including supplements and over-the-counter medications, to rule out this possibility. It's crucial to differentiate between a benign itch and one that requires medical attention. Pay attention to these questions and characteristics to identify when you should be concerned and when you can manage the situation at home. It's normal for itching to be localized to a specific spot and temporary. For example, it might appear after scratching a bite and then disappear. It's also common for it to improve with hydration or changing hygiene products. Consider whether the climate is very dry or if you're using soaps or detergents that can irritate your skin. If the itching is mild, intermittent, and responds to simple measures like moisturizers or drinking more water, it's probably not cause for alarm. Be alert if itching is widespread throughout the body and persists for more than 4 to 6 weeks without apparent cause. This persistence is a key indicator that something more serious may be going on. Itching that worsens at night, disrupts sleep, or doesn't improve with common treatments is also a warning sign. Don't underestimate the impact of lack of sleep on your overall health. If the itching is accompanied by other symptoms, a doctor's appointment is essential. Seek medical attention if you experience fever or night sweats, especially if severe and unexplained. Unexplained weight loss, no change in diet or exercise. Yellow skin or eyes, jaundice, a clear sign of liver problems. Swollen lymph nodes, lumps in the neck, armpits, or groin. Extreme fatigue or weakness, which does not improve with rest. Changes in the color of urine or stool, very dark urine or very light stool. These symptoms, combined with persistent itching, are warning signs that shouldn't be ignored. The story of Lucia, 58, is a clear example. She noticed itchy feet and hands at night. She thought it was allergies, but decided to seek medical attention. The doctor ordered tests and discovered a liver disorder, elevated levels of alkaline phosphatase, bilirubin, and transaminases. Thanks to this early detection, she was able to change her diet and receive treatment, avoiding serious complications. Her case proves that listening to your body can save your life. Don't ignore what may seem like a minor symptom. Sometimes the simplest signs hide serious problems. If you experience persistent itching or any of the warning symptoms mentioned above, it's essential to see your doctor. Your doctor will take a detailed medical history, perform a physical examination, and, if necessary, order laboratory or imaging tests. An early diagnosis can make a crucial difference in the prognosis and treatment of many diseases. For common, benign itching, there are several steps you can take to ease the discomfort and prevent it from occurring. Constant hydration, drink plenty of water, and use emollient moisturizers daily, especially after bathing. Short, warm baths. Avoid very hot water, which can dry out your skin. Mild, fragrance-free soaps. Choose hypoallergenic, fragrance-free products. Cotton clothing. Wear loose-fitting clothing made from natural fibers that allow your skin to breathe. Avoid irritants. Identify and eliminate any products or substances that may be causing irritation. Control the environment. Use humidifiers in dry environments. These simple practices can significantly improve your skin health and reduce the incidence of itching. Prevention is always the best medicine. Itching isn't always a trivial problem. Listening to your body can save your life. Don't ignore what may seem insignificant. Sometimes the simplest symptoms hide serious signs. Education and prevention are our best tools. If you found this video helpful, please like and share it with your friends and family. 90% of people experience itching, and many don't know when it's normal and when it's not. Your contribution could motivate someone to seek medical attention early, and we can eradicate a serious problem. Don't suffer with a rash that doesn't go away for more than 4 weeks. Your health is your greatest asset. Take care of yourself and your loved ones.